Hi, everybody. So today I'm going to be talking about cocaine and crack cocaine. My name is Sammy Schwalbe, and let's get started. So, what I'm going to be kind of talking about today is what is cocaine, the addiction on campus, and the social impact and how to help. So, cocaine versus crack cocaine, there are many differences between the two, but we're going to mostly focus on cocaine today. So, cocaine is a stimulant that derives from the South American coca plant, where it is turned into a white powder or crystallized in order for its users to smoke or snort. So, just to kind of touch on a few key differences. Cocaine is the white powder that can be snorted, injected, or rubbed into your gums, and crack is that solid rock-like crystals that can only be smoked. Um, the differences between the onset and duration is that cocaine has a slower onset when you snort it or inject it and rub it into your gums. The effects of the stimulant will last longer, so it'll last between 45 to 60 minutes, sometimes shorter depending on who is taking it and their body weight, all of that type of stuff that comes into mind. Um, as for crack, you'll get this immediate rush that just lasts for a few minutes and then you will have to reuse. Um, but yeah, so how it works in the body is once in the body, it'll trigger dopamine, serotonin, norepinephrine responses into the brain to release, raising the prevalence inside of the body. From there, it'll affect your central nervous systems and your peripheral nervous systems by raising your heart rate, body temperature, blood pressure. It'll also heighten your senses. So, touch, taste, smell, sight, hearing, all that type of stuff. It also can cause muscle twitches because there's so much new energy that is inside of the body because of the stimulant, making the adrenaline, the rush, all of that type of stuff, make the user who is using that cocaine to want to keep moving and do a lot of things. So, why do people use cocaine? There are many different reasons why people use cocaine. It can kind of be boiled down into about three. So life stressors, school, work, extracurriculars, family, and friends. Any drama or any issues with any of those that can stress somebody out will make them more susceptible to trying cocaine because they want something that'll boost their mood, boost their energy, all of that type of stuff. Self-medication. A lot of people will tend to self-medicate for mental disorders like anxiety, depression, and PTSD just because they are down in the dumps and they want to boost their mood as well through that way. And they think that cocaine, because it is a quote unquote um, Schedule 2 medically approved drug, not in this way, it can't be. The only way it is medically approved is through a local anesthetic. Since cocaine does have numbing properties, they can use that as a topical and topical only, not the powder, not crack as well in order to subside the pain for small little surgeries or small little treatments that doctors or medical professionals need to perform. Also, peer pressure. College students are vulnerable and they make new friends and they might want to uh, experience new things and might experiment with drugs in order to seem cool or to fit in with their newfound friend groups. So, why is this important on college campuses? College is a time for autonomy to experiment, to try new things. There are also a lot of parties that are hosted on college at college campuses. By either way, their bars, their fraternity events, or anything like that. There are some sort of house party, college party, where people are using these substances in public. So we just kind of want to be mindful and aware of how to help, um, and how to kind of keep an eye out for all of these things on college campuses. So, touching back on how fast these effects kick in, smoking begins immediately, lasts between 5 to 10 minutes. Injecting also begins immediately, lasts between 20 to 60 minutes. And sorting begins in 3 to 5 minutes and lasts 15 to 30. All of these effects and their duration kind of depend on who is taking it. So, these are just kind of ballpark estimates for you. So, symptoms you might feel when taking cocaine are joy, feelings of euphoria, increased confidence, increased energy, sociability, dopamine, adrenaline, heart rate, all of these type of things. While they may seem really positive, they seem really enticing, and that kind of like captures the attention of those who are feeling depressed or low energy. This might be really appealing to them. Um, However, there are negative side effects that come along with it, like constriction, where basically your blood vessels, arteries, veins, all that type of stuff, will tighten using those muscles around those to elevate your blood pressure. It'll also increase your heart rate, increase your risk for stroke. It'll damage your nasal cartilage, if you do snort it, as the residue cocaine will still stay in the nose and kind of deteriorate that nasal cavity. Lung damage, if you're smoking, it's going to destroy the linings of your lungs. Um, so something we want to kind of keep an eye out for. Um, Cocaine also causes restlessness, so since it is a stimulant, you're going to be kind to want to move and not be able to sit still. So that um, cause restlessness. Why this is really negative is because a lot of cocaine users will take it at night during parties, all that type of stuff, and that'll really balance um, their internal clock and cause them to not sleep as well. So, an estimated 22,174 people died from a cocaine overdose in 2024. As this is down from 2023 with about 30,000, this number is still pretty prevalent. So, it's something we kind of want to talk about and its misuse on campus. So, it can act as a confidence booster. Um, People on has this assumption in college that alcohol and cocaine kind of cancels out because one's a depressant, one's a stimulant. So you can be able to take both and not feel the feelings of both, which is obviously not the case. Um, College students also want to experiment due to the independence that college brings. And then again, they want to fit in with their peers more commonly in men than women because men are more likely to use cocaine. They are also enticed in order to fit in, or they are coerced into taking cocaine in order to fit in, and women are more likely to stand against that and kind of stand their ground and be like that, be like, no, I'm not going to do that. Whereas men will be like, okay, fine. I'll kind of give in through that way, which is obviously not great. So we're going to take a peek at the data really fast. 927 out of 6,936 college students have admitted to being, who have been admitted to being discriminated on campus, admit to using cocaine. So whether they're in a minority, like a racial minority, a sexual orientation minority, gender minority, those students who face discrimination on campus or outside of campus will admit to using cocaine, which is really scary. So we kind of want to keep an eye out for that. In the middle here on this table, this research study essentially wanted to track the opportunity students had to use cocaine from their freshman year all the way to their senior year, and how many of them took that opportunity to use cocaine when they were given that opportunity. So they were what they found is that by their fourth year, their senior year, a lot of people were offered cocaine and took it. Um, and so that way that number is higher, and that number was higher for men compared to women. Um, However, in the first year, there weren't as many opportunities to use cocaine, and if they were, they would more likely say no. But that mere exposure effect of being at college, being there for a while, um, allows people and students to rationalize being like, okay, I can do this. I'll take it. I'll try it. Why not? By their senior year compared to when they first started college, in their first year. Also on the right, the research consistently shows that cocaine, negatively impacts academic performance and behavior, um, because of the stimulant that cocaine is. A lot of people are not going to want to sit still in order to do their exams, do their homework, all of that type of stuff. And they might act out in ways that they rationally would not do when they were sober. So putting two and two together, that's going to create a poor academic performance in that realm. So the legal impact of being caught with cocaine, there are many different things. A lot of them include fines, jail time, probation, going to drug training. As for the university side, suspension, expulsion, academic probation. If they are an athlete, they can lose their athletic scholarship. If they live on campus, they can lose their on-campus housing. They can also lose their financial aid from the school that way. So, how on campuses can we do better, and what can campuses do to do better? Um, multitude of different resources. They can provide counseling to those who are struggling, but necessarily don't want to curb that addiction yet, or might kind of like look into their options. So being able to talk with a non-biased person, non-judgmental person is a really good start that campuses need to take action towards. Education on campus, it's really hard to kind of find strong information that's really clear and consistent. I kind of had a little difficulty doing this with this presentation, anyways. So I think having more clear education on preventative measures to inform students on the dangers of cocaine will definitely help students think twice about what they're doing, and having rehabilitation accessibility. So, giving those who are struggling the access to rehab and treatment to subside their symptoms to help them stop that addiction, because a lot of college students don't have the time to fully check in to a rehab center. So, being able to kind of do that from the comfort of their campus, or being um, transmitted somewhere transferred somewhere else that can help them with that rehab, and making it super accessible for low income college students is really important. But overall, just being able to be more aware. A lot of campuses provide overdose training, all of that type of stuff. So having students be able to be aware, understand of what to do when someone is not okay in that situation will definitely help keep campus a better and keep campus better and safer for all students. So here are all my references. That's all I have for you, but thank you very much for listening.